All right, Dr. Brian McKay, Core Health and Darien. What are we going to excite you with today, information wise? All right, radial extracorporeal shockwave therapy for myofascial and articular pain. All right, let's do that one more time. Extracorporeal shockwave therapy for myofascial and articular pain. All right, so we all have aches and pains. Well, some of us more than others, and I'm certainly feeling the pinch lately. But what I want to stress here is that there are a number of soft tissue techniques, and the the radial extracorporeal shockwave therapy I have personally found to be a very, very effective way to help with different soft tissue pain. Um, it's not new, and it basically got its start. Um, it's the same technology they used to break up kidney stones. So if you're familiar with kidney stones, that would be the same manufacturer that started doing is using the shockwave therapy for different pain syndromes. And so it's a slightly different machine, same concept, more for in office. But again, it was started in the 90s for the kidney stones and is very successful in treating musculoskeletal. So the type of things we see, like say you have Achilles tendonitis, the tendon becomes dysfunctional and you get scar tissue. Scar tissue begets more scar tissue. So what this does is it breaks up the scar tissue. It allows the reabsorption of the scar tissue, and it stimulates blood flow by creating a thing called angiogenesis. Angiogenesis is where blood vessels are created. Um, an interesting side note, though, is the extracorporeal shockwave therapy is also, sometimes called radial shockwave therapy, interchangeably. Let's call it shockwave therapy. It's a lot shorter word. But the interesting note is there are urologists using it to treat erectile dysfunction in men. I don't particularly treat erectile dysfunction here at Core Health, but it's just a side note that it stimulates blood flow, and that's the rationale behind it. So what we're typically seeing is, okay, you got, say you have heel pain from plantar fasciitis or Achilles tendonitis. Again, you break up the scar tissue, and it's not really scar tissue. Let's call it adhesions. Adhesions is disorganized cellular growth. So instead of having like tissue grow nice and organized, it's disorganized. And what happens then is it gets bigger and bigger the more you put repeated stress on that area. So if it's a foot, the more you stand on it, well, the more pain you're going to have in that foot. It's also particularly effective for knee pain, because there are indications, like the manufacturers do not say it, is more anecdotally, that does help produce stem cells. So if you have a bad knee and you want to get some stem cell of your own volition, where your body produces it himself, that would be a reason to do it. We don't promote that particular thing. It's an off-label use. So it's just more of a side note and kind of an interesting thing to know. But as far as breaking up the scar tissue, it's very effective and it's fast. I mean, a treatment will take about anywhere from 1,500 to 2,500 shocks delivered about 10 per second. So it's really not a long time of treatment. But what it does is it gets the blood flow, breaks up the adhesions, stimulates blood flow. So if you have long-standing plantar fasciitis, tennis elbow, shoulder pain, knee pain, the radial shockwave therapy is a very healthy, almost painless. I mean, some people have some discomfort if you hit the bone, but what you're trying to do is you're trying to stay on the soft tissue, and for the most part, people feel like a pulsing sensation against the skin. Now they're doing more and more studies on it, and that's the key thing. Is like, you know, let's just say the myofascial pain syndrome. That's what So it creates pain throughout the whole body. Um, so myofascial pain can be any area of the body. You can have it in your calf, you can have it in your rectus femoris, you can have it in your trapezius. But the idea is when people get a number of these you know, different we'll call myofascial pain syndromes, the term is fibromyalgia. You probably already heard of that one. That's nothing new. But Core Health has been using this now for quite some time, and we're seeing enhanced results because this day and age, the less a patient is seen, the less expensive the healthcare is. And I think the bottom line is you always got to be a little bit cognizant of how much money someone's spending. And if you could do something faster, um, not just in making the person heal quicker, and if you keep the cost down, it makes for more effective relationship with the patient. Patient's happy, I'm happy, and it's a very good way to ease that kind of pain. So if you're having problems, like I said, tennis elbow, shoulder pain, knee pain, this is your chance to really try it out. And what you just do is give us a call. Our office is 203 656 3636, 203 656 3636. And if you want to just talk about it, I'm more than happy to jump on a call with you and explain how it works. But it's easier actually just to demonstrate on you. So call, make an appointment, go to the website, www.darien-chiropractor.com. Once again, www.darien-chiropractor.com. And book an appointment online. It can't hurt. It can only help. And I hope you found this to be interesting because I sure do. And it's definitely helping people in chronic pain. All right, Dr. Brian McKay, Core Health and Darien, explaining radial shockwave therapy. All right, have a good day. Talk to you later.